Welcome to the NCLEX Success tutorial on pediatric gastrointestinal disorders, vomiting. Vomiting is the forceful expulsion of stomach contents through the mouth and is often accompanied by nausea. Assessment. Assess the frequency, volume, and characteristics of vomiting episodes. Evaluate associated symptoms such as abdominal pain, fever, and signs of dehydration. Review the patient's medical history, including recent illnesses, medications, and dietary habits. Concerns: dehydration due to fluid loss. Electrolyte imbalances, especially potassium, hypokalemia due to repeated vomiting. Risk of aspiration pneumonia if vomiting is severe or frequent. Nursing management: provide a clear basin or emesis bag for safe vomiting. Offer small, frequent sips of clear fluids like water, ginger ale, or oral rehydration solutions (ORS) after vomiting subsides. Administer antiemetic medications as prescribed to control nausea and vomiting. Monitor for signs of dehydration and electrolyte imbalances and intervene promptly. Medical and fluid management: administer IV fluids if oral intake is insufficient to maintain hydration. Correct electrolyte imbalances with appropriate supplementation, such as potassium replacement. Investigate and treat underlying causes of vomiting, such as infections or medication side effects. Parent teachings: instruct parents on proper administration of antiemetic medications if prescribed. Educate on signs of dehydration and when to seek medical attention. Emphasize the importance of a gradual return to a normal diet after vomiting resolves. Diarrhea. Diarrhea is characterized by frequent loose and watery stools. Assessment: assess the frequency, consistency, and color of stools. Evaluate for associated symptoms like abdominal cramping, urgency, and tenesmus. Check for signs of dehydration such as dry mucous membranes, decreased urine output, and sunken eyes. Concerns: dehydration and electrolyte imbalances due to fluid loss. Nutritional deficiencies from malabsorption of nutrients. Risk of infection transmission if diarrhea is caused by a contagious agent. Nursing management: encourage oral intake of clear fluids, electrolyte solutions, and easily digestible foods. Monitor stool output, consistency, and color. Administer antidiarrheal medications cautiously, considering the cause and potential risks. Implement infection control measures to prevent the spread of infectious diarrhea. Medical and fluid management: administer IV fluids for severe dehydration or inability to tolerate oral intake. Treat underlying causes such as infections with appropriate antibiotics. Consider probiotics to restore gut flora balance in certain cases. Parent teachings: educate on the importance of fluid replacement with ORS or electrolyte solutions. Advise on dietary modifications, including the avoidance of spicy, fatty foods initially. Instruct on proper hand hygiene to prevent infection transmission. Discuss when to seek medical attention if diarrhea persists or worsens. Bacterial food poisoning in pediatrics. Bacterial food poisoning occurs when a child ingests food contaminated with harmful bacteria, such as Salmonella, E. coli, or Campylobacter. Signs and symptoms: abdominal pain and cramping, nausea and vomiting. Diarrhea may be bloody in some cases. Fever, dehydration, dry mouth, decreased urine output, sunken eyes. Fatigue and weakness, loss of appetite. Nursing management: assess the child's vital signs, hydration status, and severity of symptoms. Monitor for signs of dehydration and electrolyte imbalances. Encourage oral rehydration with electrolyte solutions like Pedialyte or ORS to replace lost fluids and electrolytes. Provide a bland diet, e.g. brat diet, bananas, rice, applesauce, toast, initially, and gradually reintroduce normal foods as tolerated. Implement infection control measures to prevent the spread of bacteria to others. Medical management: collect stool samples for bacterial culture and sensitivity testing. Administer antibiotics if indicated based on the specific bacterial strain and severity of symptoms. Use antiemetics and antidiarrheal medications cautiously to manage vomiting and diarrhea. Hospitalization may be necessary for severe cases requiring IV fluids and monitoring. Parent teachings: educate parents on proper food handling and storage to prevent bacterial contamination. Instruct on cooking meats thoroughly, avoiding cross-contamination, and refrigerating perishable foods promptly. Emphasize hand hygiene for both children and caregivers before and after handling food, using the bathroom, and changing diapers. Teach parents to recognize signs of dehydration and when to seek medical attention if symptoms worsen or persist. Complications. Dehydration can lead to electrolyte imbalances, kidney problems, and in severe cases, shock. Hemolytic uremic syndrome, US. Associated with E. coli infection, HUS can cause kidney failure, anemia, and low platelet count, requiring intensive medical care. Let's look at lead poisoning. Lead poisoning occurs when there is an accumulation of lead in the body, often due to exposure to lead-based paint, contaminated water, or lead-containing products. Children are particularly vulnerable to lead poisoning due to their developing bodies and behaviors like hand-to-mouth activities. Lead testing is typically recommended for children at risk, including those living in older homes built before 1978, when lead-based paint was banned, children living in high-risk areas with industrial pollution, and those with developmental delays or behavioral issues. Lead screening may start around age 1 and continue periodically during childhood. Signs and symptoms. Developmental delays. Lead poisoning can impair cognitive function, leading to delays in learning, speech, and motor skills. Behavioral changes. Children may exhibit irritability, hyperactivity, aggression, and difficulty concentrating. Gastrointestinal symptoms. Abdominal pain, nausea, vomiting, and constipation may occur. Neurological effects. Headaches, seizures, sleep disturbances, and memory problems can result from lead exposure. Anemia. Lead can interfere with red blood cell production, causing anemia, fatigue, and weakness. Nursing management. Assess risk factors. Identify children at risk of lead exposure based on housing conditions, environmental factors, and developmental concerns. Education. Educate parents on lead-safe practices, including regular cleaning of dust and debris, using lead-free products, and avoiding lead-contaminated water. Encourage nutritious diet. Promote iron-rich foods to help prevent lead absorption and support healthy blood cell production. Screening and referrals. Facilitate lead screenings as recommended and refer children with elevated lead levels for further evaluation and management. Medical management. Blood lead testing. Confirm lead levels through blood tests with levels 5 micrograms per deciliter (mg/Bella), indicating elevated lead exposure. Chelation therapy. For severe cases with significantly elevated lead levels, chelation therapy may be used to remove lead from the body. Supportive care. Manage symptoms such as anemia with iron supplementation and provide interventions for developmental delays and behavioral issues. Parent teachings. Home safety. Advise parents on lead-safe practices at home, such as regular cleaning, proper ventilation, and using lead-free paint and products. Nutrition. Emphasize a balanced diet rich in iron, calcium, and vitamin C to reduce lead absorption and support overall health. Hygiene. Encourage hand washing and good hygiene practices to minimize exposure to lead-contaminated dust and soil. Complications. Neurological damage. Lead poisoning can cause permanent cognitive impairment, developmental delays, and behavioral disorders. Anemia and organ damage. Chronic lead exposure can lead to anemia, kidney damage, liver toxicity, and reproductive problems.